You are not imagining it. You're not just getting old. You're not just losing your mind.
That's brain fog. And if you have RA, it's not your fault.
I had a patient come in last month and she looked at me and said, "Doc, I think I'm losing my mind." She told me that she walks into rooms and forgets why she's there. She's in the middle of a sentence and the word just disappears. Her husband thinks she's just not paying attention, but she is. She just can't hold on to things the way she used to. She's already been to her gynecologist because she thought it was menopause or perimenopause. That's not it. It was her rheumatoid arthritis. And here's the part that really worried her. The medication that she takes every week to help protect her joints. There is evidence that says that it could be making the brain fog worse for her right now, but stopping the medicine could be even worse for her for long-term health. I know that sounds odd, like a contradiction, but there is data behind this. I'm Dr. Neha, a rheumatologist. Let me explain what RA is exactly doing to your brain, why your medication is a double-edged sword, and what you can actually do to improve things. And for those of you that feel that your symptoms are really more significant than just a typical brain fog, I'll tell you about a test most patients don't even know exists that can actually measure what your brain is doing. Let's dive in. First, let me be clear about one thing. Brain fog is real. It's not in your head. Well, actually it is kind of in your head, but not the way people dismiss you for it. The problem with it is there is no objective test, like a marker on a blood test that says this is your brain fog level. That would make life easier. Now everybody's different, but studies are showing that about 30 to 70% of people with rheumatoid arthritis have some sort of cognitive dysfunction. That means that it could be problems with memory, word finding, you can't concentrate as well, that heavy foggy feeling that makes you feel like you're thinking through wet cement. And for years, for decades even, people were just told that it was anxiety, depression, just getting older. Because who does RA really affect? Most of the time it is women kind of in their reproductive years or 40s and 50s that are, of course, getting older. But that's not exactly the reason here. There was an actual research study a couple years ago that showed that in RA and also lupus, MS, multiple sclerosis, these groups of people, they compared them to a healthy population, meaning those that did not have these specific autoimmune diseases. And RA patients consistently scored lower on memory, verbal communication, attention, and problem solving. So it's not your personality trait and it's not anxiety. It's biology of RA. But here's something that was actually surprising about this. And this is important because it changes how we approach it. There was a large study, several thousand people, and they found that once you controlled for the pain levels, the depression, and physical inactivity, so you needed to move more, that cognitive gap between RA patients and healthy controls, it disappeared. Because we know there are more issues with pain and depression, and you can't move as much sometimes when you have RA because you're in pain. If we really did address those things though, people did better. And this tells us something very important. It's that RA is not directly destroying your brain cells, which is a big relief. It's what the RA does to your life. The chronic pain, the disrupted sleep, right? It's hard to get comfortable, or you wake up early because you're in pain. The medications that you take, the way you just don't move as much as you used to. That is driving a lot of this brain fog. And that's actually good news because it is something that we can target. It's not as quick as a pill, but it is something that we can at least work on. So what are those 4 main things? Let's go through each of these. The first driver is inflammation, systemic inflammation. And this is the one that a lot of people don't connect to their brain. But in RA, your brain is in this constant state of activation. It's throwing out all these inflammatory molecules called cytokines, TNF, IL-6, IL-1. You might have heard these names if you're on biologic drugs. They're not just attacking your joints. Like that's what we think about, right? All the inflammation is attacking our little joints. It's not only that. They're circulating through your entire body, including your bloodstream. And your brain has a protective barrier. It's called the blood-brain barrier, the BBB. And it's designed to kind of keep those inflammatory signals out. So it should be at least somewhat protected. The problem though is in rheumatoid arthritis, this barrier, the BBB, research is suggesting that it becomes a little bit permeable. So more things can enter. And those inflammatory molecules that we don't want in there, they're maybe getting through. They're activating the brain's own immune cells called microglia. And this is triggering in areas that are directly tied to memory and focus. This is why when you have a flare of your RA, your brain fog can be worse. Have you ever noticed that? Like everything else is hurting, your ankles are hurting, your hands are hurting, but also you're just not with it as much. You're just groggier, drowsier, a little bit slower. Let's put it that way. And because I am also boarded in lifestyle medicine and I love to talk about integrating it into rheumatology, one thing that most rheumatologists do not talk about is the gut connection. Your food, the most important part. Your gut microbiome produces these short-chain fatty acids, butyrate, propionate, acetate. These are kind of the common ones. And you get them from fiber in your diet, which is why I'm always talking about fiber. But some of the new research that's coming out is showing that these molecules, they help maintain the integrity of the BBB, the blood-brain barrier. So the gut and the brain, yes, there's research showing that they're connected. But what we do know is that RA disrupts the gut microbiome. We know that gut dysbiosis, which is just a fancy way of saying that the gut bacteria are out of balance. You might have more bad bacteria as compared to good bacteria. That's it. And we know that this gut dysbiosis is related to this blood-brain barrier permeability. While we wait for those trials from RA to brain fog through the gut, we do know that the gut really influences so much of how we feel, which is why I say that diet is so important when you have rheumatoid arthritis or any autoimmune disease. What you eat is important not just for your joints, but also for your brain. Now, here's the part that I really need you to pay attention to, because this is where I see my patients making decisions that genuinely worry me. Methotrexate. Most of you have heard of it or have been on it in the past, and we know it's one of the most effective medications that we have. Sure, we layer it on with biologics when we need to, but yes, we also know that it can cause brain fog. Many of my patients on methotrexate do complain about that, especially the day after methotrexate. That's kind of like the foggy day, forgetting words, feeling slower. This is real. Methotrexate is a folate antagonist. So basically it's interfering with the folate in your body, and folate is really important for brain health. So a lot of women trying to become mothers are on folic acid, or if they're already pregnant, right? Because we're worried about brain health. But also this is actually why we prescribe it alongside methotrexate. Also, it helps the liver and it can help nausea as well. But this is the additional reason. And methotrexate, especially at the higher doses, can really affect how you feel, how your brain feels, the cognition of it. After I just said all this, you might be thinking, okay, I better stop my methotrexate. Please don't. Not without talking to your rheumatologist first. Here's why. There was a large European study that was recently done, and it found 29% fewer dementia cases in those that had RA that were taking methotrexate, especially on patients who had been on methotrexate for more than 4 years. That risk reduction was even more striking. Now, does this mean that taking methotrexate for your RA will prevent dementia? No, it's not quite saying that. But there is some research that is showing that even though you get that brain fog, it's not necessarily causing worse long-term things like dementia, and it could be protective against it. All good things, because we of course are always worried when we've had a medication and we're causing more problems than we're solving. Methotrexate has been around for almost 50 years for RA treatment, so we know a lot about it compared to some of our other medications. It may not be the right medication for you if it's not helping your joints or anything else. But on the other hand, if it is helping and you do get the brain fog, there are some things you can do around it to help you. So the conversation to have with your rheumatologist is not, should I stop it? It's 3 specific questions. 1, is my folic acid dose adequate? Because in America, we generally say taking about 1 milligram a day. Some people skip the day of methotrexate. You don't have to. In the UK, it's about 5 milligrams a week that's recommended. But if you're having some of these symptoms, it's okay to go up a little bit, not too much. Because there was a recent study that said that having too much folic acid can maybe increase your risk of heart disease. But that study was over 5 milligrams a day, which we don't generally tend to give. And it does need to be replicated, but it does give us pause of using too much folic acid. Question number 2, since this medication that you're taking on Wednesdays may be protecting your brain over the next decade, it's important to figure out if there's a different day that might work better for you. Usually when I write the prescription for methotrexate, I write Saturdays. One reason is because I don't want people to take it every day, and this is an easier thing if you put one day of the week. And I tell people you can change it. I just want it fixed. And the reason I generally say Saturday is that Sundays are often kind of a relaxed day for people. And it's usually the day after methotrexate where you have more problems. So instead of taking it on Wednesdays or Tuesdays, maybe Fridays are better for you. You kind of have to find the right day of the week because the next day could be affected. Sometimes the day after that too, but usually to a much lesser degree. 3, is the dose that you're on of your methotrexate the lowest dose that you need, that you can really get away with and still be in remission? And one thing to be clear about is that leucovorin or folinic acid, oftentimes you'll see it online as a great medication to counteract methotrexate's side effects. And it can, a lot of the different side effects. But really high doses of this could also worsen things. So just talk to your rheumatologist without taking it before you start taking it on your own. And prednisone and cortisone, they deserve a mention here. When you're on a tiny bit, usually it's okay. But if you're on kind of these moderate or high doses of steroids, they are associated with attention deficit, memory issues, cognition issues, just not being with it. So just remember that and be kind to yourself if that's the case, because women appear to be particularly sensitive to this. So getting off of those steroids matters just as much to your brain as to your bones and your bone health. The third driver is sleep, and I think it's one of the most commonly misunderstood in my clinic. RA disrupts sleep in so many ways. Pain wakes you up. Morning stiffness in your joints, it pulls you out of bed early because you need to move around. Many of my patients describe getting up at 3 a.m. and just lying there awake, uncomfortable. And then you drag through the next day like you're in a fog. And we know from sleep research that when you go to sleep is when your body heals. And when RA disrupts that night after night, your cognition, it suffers. This isn't complicated. When you're chronically sleep deprived, it directly impairs memory, focus, processing speed. That's why we say when you're about to take a test, get a good night's sleep. Nobody says just sleep only enough. No, you want to get a good night's sleep. You want to have that ability to pull back all of those functions of your memory that you need. But to be honest, I'm a rheumatologist. I'm not a sleep specialist. So what I can help is optimize medications so that the RA does better. But if sleep is a chronic issue and you're not finding improvement, it is a good idea to talk to a sleep specialist. I refer people often. But the first question to ask also is your nighttime pain controlled? Because the biologics, the disease-modifying drugs, they can only do so much. Sometimes you have pain from different issues. One of my patients recently who has long-term RA is doing excellent on etanercept, was complaining of 10 out of 10 pain. And he does this every visit, but the pain is not the RA. The pain is his arm because he had shingles. And that shingles pain is way worse than any of his RA pain. He cannot sleep at night, so he feels miserable. And his doctor has tried lots of different things to help with the shingles pain. But he will tell you it is day 123 since he had that shingles episode. Day 246. Every time I see him, I get a different day. So there are different causes that can cause pain. And is that pain being controlled? Sometimes it's not so easy, but it's definitely one thing to approach. The fourth driver, which definitely does not get enough attention, is fibromyalgia. Fibromyalgia is extremely common in rheumatoid arthritis patients, and a study from the American College of Rheumatology found that having fibromyalgia is actually a comorbidity. What that means is that you may do worse with your RA overall when you have that fibro with it, which is common, like 30% or more of our RA population. And it's one of the strongest predictors of impairment in RA, above and beyond having active disease. And here's why this matters. Having fibromyalgia causes something called the fibro fog. And arguably, especially if you ask my patients, it's one of the worst forms of brain fog, sometimes worse than having the active RA disease or psoriatic arthritis or lupus. And 50 to 80% of fibromyalgia patients report it as one of their most disabling symptoms. So when somebody has RA plus fibromyalgia, you're dealing with two completely separate mechanisms that is driving those brain symptoms at the same time, which of course makes it all the more challenging. So if you can treat that fibromyalgia separately than you treat your RA, that would be the best. And remember when we talked about if you have RA and your brain fog feels completely out of proportion to your joint pain, like your joints are really not doing that bad, but this brain fog is taking over your life, you feel like you have cotton stuffed in your brain, fibromyalgia is something that is worth discussing because the treatments are completely different. Non-restorative sleep, chronic pain, stress, they all feed into the fibromyalgia, which feeds into the brain fog, which feeds back into more stress, more loss of sleep. It's a cycle, and the first step is to recognize it so that you can break it. And I do want to briefly mention menopause here too, because many of my patients are dealing with both RA and menopause or perimenopause. Estrogen loss on its own does affect brain function, memory, mood, processing speed. And if you have RA and you're in this transition, you may be dealing with two separate contributors, sometimes three if you throw in RA, fibro, and menopause, that are all contributing to your brain fog separately, simultaneously. So you may need to have this conversation with not only your rheumatologist, but also your gynecologist. Okay, so what do you do about this brain fog? Well, number one, this is non-negotiable, and it's the foundation of everything else. You need to control that inflammation. That inflammation that's driving your joint damage is also influencing your brain. Get your RA into low disease activity or remission. It's one of the most powerful cognitive interventions that's available if we can get you there. I know we have a lot of medications out there, but still we feel limited because a lot of people have cycled through so many without great relief. And I'm going to do a talk on when it's time to change medications. But for now, if you are not well controlled with the RA, and you're going to have to piece apart what is RA and what is fibromyalgia, what is something else. So you need to get that RA under control. Number two, have a specific conversation about medications. It's not easy. I don't always bring it up because I'm bringing up so many different things and I forget and ask, is your brain fog worse the day after methotrexate? Because I know that can happen. I may have said it in the beginning when I first gave you the prescription, but oftentimes people don't absorb everything that the doctor tells them during the visit. Or the visit is short because there's other things going on. So bring it up. Other medications also can cause a problem like gabapentin, which many people are on for muscle pain, for their fibromyalgia. that also can cause this loopy-doopiness on it, and sometimes completely unrelated medication. You have to be a detective for yourself sometimes. When something new is started and there is symptoms, pay attention at one thing at a time. Can you piece apart what is causing those issues? Don't forget to ask about the folic acid. Should you increase the dose? Should you change the day of your methotrexate? Number 3, I know exercise sounds impossible when your joints hurt, but this one has real specific RA data behind it. There was a 10-year study, 1,200 patients with RA, and they found that the patients that met the standard exercise guidelines, which was 150 minutes a week, they were protected against this cognitive decline compared to sedentary patients. So exercise reduces systemic inflammation. One of the best things you could do for yourself is just move. It improves sleep. It has direct brain benefits. And even walking counts, so you can just start there and then slowly go up. Number 4, a fiber-rich diet, because we have to talk about food when we talk about inflammation. That fiber-rich diet supports your gut microbiome, which supports your blood-brain barrier. And this does not mean a complicated elimination diet, an AIP, autoimmune protocol diet, nothing like that. Just eat well, eat clean, try to cut out the garbage, and see if you feel better. Be consistent. Number 5, take your sleep seriously as a medical intervention. It's not just something like, okay, I only got a few hours. Some people like to brag that they only get a few hours, and they do so well. Don't be one of those people. Get enough sleep. And consider a formal sleep referral if it's really a problem for you. Number 6, if your brain fog feels so disproportionate to your joints and how they're feeling, talk about fibromyalgia. See if that's something that you have and what the treatment is that's available to you. And number 7, for those of you that really feel like your brain fog is so severe, it's affecting your life and you're worried it could be something much worse, there is formal testing you can do. It's called neuropsychological testing, and it's this structured battery of tests. It assesses memory, attention, your processing speed, and your executive function. It gives your doctor a more objective baseline. It doesn't just say you have brain fog. It kind of tells you where it could be coming from, how severe, and how something else could be contributing to it. It's not perfect. It's not an exact measure, but it does give you a lot of information. I typically refer to a neurologist who usually has people set up for neuropsychiatric testing or neuropsych testing. Most people don't know to ask about this, but yes, ask your rheumatologist, talk to them about it, and they may send you to the neurologist or neuropsych testing centers if they have it near them, and they can just send a referral. Here's what I want you to take away. If you're sitting there thinking, this is me, I have brain fog, and I feel like this every single day, you are not imagining it. You're not just getting old, you're not just losing your mind. You're dealing with a systemic inflammatory disease, RA, and it affects more than just your joints, and a medical system that doesn't take this seriously enough. The good news, and I genuinely mean this, is that when we control the RA really well, those cognitive symptoms improve. Your brain is not a bystander in this disease. It's not affected directly like some other conditions, but it is affected. So the next time that you walk into a room and you forget why you're there, think about all these things that we just talked about and where it could be affecting you. There are things to work on. Drop your questions in the comments. And if you know somebody with rheumatoid arthritis who's been told that their brain fog is just stress, please share this video with them. I'm Dr. Neha with Plant Forward MD. I'll see you next time.